Hello, my name is Iliana Benhumea Castillo. I study nutrition in UNADEM. This activity is the evidence of Unit 1 reading strategies. I'm going to talk to you about chronic kidney disease. It's an affection of the kidneys that causes them to not be able to perform their normal functions. Glomerular filtration rate is the passage of fluids from the glomerular capillaries to the nephrons through the blood pumping from the heart. To be filtered, control the amount of water and substances dissolved in body fluids, produce urine, and discard unused fluids. Chronic kidney disease can be caused for different factors. The main ones are nutritional factors and obesity, as well as hypertension. Obesity has a great impact on nephrons because with obesity, glomerular filtration must increase because metabolic demands increase. So nephrons must work much harder to maintain adequate levels of solutes, straining the kidneys. A high protein diet can affect the function of kidneys because an uncontrolled consumption of animal protein can affect the function of the nephrons. Occurring vasodilation of the arterioles, protein intake increases kidney function. In an organism where the number of nephrons is decreased, they work at their greatest capacity through the increase of glomerular and vasodilation of the afferent arteriole. Patients with chronic kidney disease must follow the recommendation of the Academy of Nutrition and Dietetics that dietary protein intake be maintained at 0.6 or 0.8 grams of protein per kilo per day. When the glomerular filtration rate is less than 50 milliliters per minute or person with diabetic nephropathy. Sodium has effects on blood pressure, cardiovascular disease, kidney function, and chronic kidney disease progression. So, some nutrition guides for chronic kidney disease recommend sodium intake no more than 2 grams per day. Vegetables and fruits are very important in chronic kidney disease because fruits and vegetables in the diet help to obtain alkali needed to reduce acid excretion and decrease the work of individual nephrons and loss of kidney function. In this disease, the DASH diet is recommended, which includes a high content of fruits and vegetables and decreases the intake of highly caloric products and animal protein. It's recommended that persons with chronic kidney disease consume 28 grams of fiber per day because it helps avoid high levels of inflammation markers, which increases the risk of cardiovascular damage and an increase in the incidence or progression of chronic kidney disease. They also help the growth of good bacteria in the intestine that strengthen its function and permeability. It also facilitates the excretion of feces and the excretion of urea and potassium. The DASH diet is distinguished by prioritizing the consumption of fruits and vegetables daily. Also decreases the intake of high-fat dairy products while taking care of the consumption of sodium, potassium, calcium, magnesium, and proteins, especially of animal origin. It also suggests adequate fiber intake, which greatly benefits chronic kidney disease patients. However, it must be individualized, modifying it according to the nutritional needs of the patient as well as their tastes and preference.